So our final speakers today are from the FEISTY or Fibrinogen Early and Severe Trauma Study. This multi-site study, clinical trial is aiming to improve outcomes for severely injured trauma patients with critical bleeding. EMF awarded this project just under $300,000 in 2016, and they went on to secure a similar amount from the National Blood Authority and the Gold Coast Hospital and Health Service, another example of leveraged funding. So the team recently finalised patient recruitment 12 months ahead of schedule and are preparing to launch a FEISTY Junior trial also with the support of EMF. So to speak to us more about this, Mrs. Elizabeth Wake, Don Campbell and Glenn Ryan. Welcome.
Thank you. Okay. Thanks very much for having us here today. I'm here to talk about the FEISTY trial. So the FEISTY trial was the brainchild of James Wernels, Dr. James Wernels, one of our intensivists at Gold Coast. It's based on our experience of using point-of-care Rotem testing in major trauma and in bleeding patients. And it's a randomised controlled trial looking at the best way to replace low fibrinogen levels, which we often see in these sort of patients, comparing traditional fibrinogen replacement with cryoprecipitate compared to using fibrinogen concentrate, which previously hadn't been available readily in Australia. And as I say, we've been using that sort of in Gold Coast for about a year prior to developing the study. One of the key things about FEISTY was implementation in all the 4 major trauma centres in Queensland, so Gold Coast, Royal Brisbane, PA and Townsville. And we were generously supported, as you just heard, by our major sponsor, EMF, as well as the National Blood Authority, with a lot of other collaborations as well. FEISTY has been recruited ahead of time, and that's a credit to the team, particularly the implementation team, which is headed by Liz, and we couldn't have done it without the buy-in of all the of the site. So you're going to hear from Liz firstly about the implementation, and Glenn representing PA, our highest recruiter for the trial.
I just briefly wanted to talk to you about some of the strategies that we implemented both before the trial and also during the trial to engage people. So a lot of groundwork was done at all the sites by Dr. James Wernels, talking with the clinicians and engaging them on board this study prior to even the development of the protocol. We specifically chose a principal investigator from the emergency department and also the ICU to have ownership of the study at all 4 sites, and that really, I think, was very beneficial throughout the whole study. The intervention itself is of high value to clinicians. This is, it's a popular topic, so I think obviously the topic choice really helped us. And we also did we were quite visible before the trial as well. We made a point of going to all the sites and presenting to every single department, both nurses and medical teams, so of the trauma patient's journey. So, we presented to the ED nurses, to the ED doctors. We then went on to the operating theatre, presented to them, the anaesthetics, the operating theatre nurses, etc., into the ICU as well. And tried to really just give ownership of the trial to the sites. We were very non-prescriptive in what we asked. We obviously wanted the protocol to be followed, and we made suggestions on how that should be done. But the sites were allowed to tailor it to suit them. So, for example, what worked at the Gold Coast might not work necessarily at the PA or the Royal. So we allowed that within the protocol itself. Once the trial started, we'd made the decision prior to the trial that we would be available 24 hours a day, 7 days a week, on a helpline number that was available to all the sites, and that was also widely publicised. And many people did ring. We didn't get a lot of sleep potentially during the trial itself, but that was the commitment that we made to ensure that people felt that they had the ability to ring and contact someone. We provided a lot of what I feel is good study resources. We had electronic resources on a USB, and that was sent to all the departments, the emergency, anaesthetics, and the ICU, and we also backed that up with paper resources as well. We were active on social media, very active on social media throughout the trial. So we tweeted every time a patient was recruited, we linked in the site, we linked in the sponsors. And I think this made us people more aware of the trial. We again, throughout the trial, visited them quite frequently. Initially, after the first 2 patients were recruited, I would go up to assist in partaking into the monitoring plan, and during that visit we would visit the ICU, the anaesthetics, etc. So again, we were highly visible throughout the trial. I think potentially what worked in our favour as well, the trials were a little bit competitive, the sites were a little bit competitive with each other. So everybody was keen to do well, so we tried to engage on that as well. I think probably that's it from the implementation. So I'll hand you over to Dr. Glenn Ryan, who was from the PA our biggest recruiter.
Thanks Liz, thanks Don, thanks EMF for having us here. So I've just been asked to say a few words about FEISTY from a site perspective. Liz is right, it was very competitive. We wanted to be the best. From PA's perspective, we wanted to recruit the most number of patients to the trial, and thankfully we were successful in that. For us, the implementation was about understanding where we were at with regards to transfusion in massive hemorrhage or major hemorrhage, working out what we actually did in terms of rotational thromboelastometry, where we're at in terms of cryoprecipitate and fibrinogen, and where we wanted to be in terms of having fibrinogen concentrate in the emergency department and having a more defined point of care process, both within the ED and within the hospital system. So for us, it was about identifying where we're at and utilising FEISTY to help us move to where we wanted to be, both as a department and as a hospital. So we were able to get significant buy-in from both the consultant group and the senior nursing staff. We decided that it would be consultant driven and senior nursing staff driven within the emergency department. And because we were transitioning to point of care, it was quite a timely process, quite a timely research project for us as a department and a hospital. We decided to take the consent away from the early phase and the randomisation away from the clinical side, and provide that empowerment to our senior nursing staff to identify who would be recruited to the study and how that would happen. So that was really impressive and some really fine work by our senior nursing staff to allow that to happen. So we really empowered our senior nurses to enable that to take place and took that decision away from the consultant group as a whole. We didn't try and force the project onto anaesthetics. We let them work out how they wanted to implement it, and same with ICU. James Winnells and Clinton Patricks were heavily involved, and again, as we did, they empowered their nursing staff to run the project primarily with senior consultant input, which worked well for us, both in ED, in anaesthetics and ICU. There was a lot of collaboration between ED, anaesthetics and ICU from a nursing perspective in terms of setting up training pathways and recruitment processes as well for the trial. And we had excellent support from Liz, from Don and from Tony again. We had an amazing support team in our ED research group as well, which was instrumental in providing support to the clinicians, but also in terms of data collection. Oh, done it again. And what has changed for us since FEISTY? It allowed us to identify a collaborative, interactive research process, both within the emergency department, across medical and nursing, and also between departments, between ED, between ICU, anaesthetics, and haematology. So from that side, we're really thankful to be part of this particular project. It allowed us to get a rotum in the emergency department through funding from FEISTY, but also giving us the impetus to put a research grant in, or an equipment grant in through the PA private research fund. And it's reshaped in many ways our transfusion pathway, both within the emergency department and across the hospital. We now have a point of care in the ED, we have point of care in the blood bank, and we're getting point of care in ICU, we have point of care in theatres. It's reshaped our transfusion practice, and it's allowed us to get fibrinogen concentrate in the emergency department. So we're grateful to the FEISTY group and also for EMF in terms of funding for this particular project, which has been really helpful for us as a department and a hospital. And that's our team. Thank you very much.